Hello, and welcome to our healthcare campaign. My name is Deepa, and today we're going to discuss some important issues that people are facing nowadays, like OAB, overactive bladder. So, to discuss about this problem, we have with us Dr. Anita Patel. So, hi, ma'am, how are you?
Hi, I'm very well, Deepa. Thank you.
So, ma'am, as you may know, that overactive bladder is very common nowadays, and people are unaware of this problem. So, before sharing details about this problem, can you give a brief introduction about yourself?
I'm Dr. Anita Patel. I'm a practicing consultant urologist in Shivaji Park area.
Okay.
I've been in practice for over 25 years.
Nice.
And apart from my own clinic, I'm also attached to Global Hospital Parade.
Okay.
And I go as a visiting consultant to Muljibai Patel Urology Hospital, which is a large only urology nephrology hospital in Nadiad, Gujarat.
Okay, that's really nice, ma'am. So, ma'am, can you tell us about like what is OAB, overactive bladder?
So Deepa, it's like this, overactive मतलब जरूरत से ज्यादा काम.
Yes.
छोटे बच्चे overactive होते हैं. So
Yes.
urinary bladder is exactly like that.
Okay.
When the bladder does more work or more activity than what it is supposed to do, we call it by the term overactive bladder. मतलब जो bladder ज्यादा चुलबुली है. That is the meaning of overactive bladder. And typically a patient of overactive bladder would come to us with complaints of severe urgency, मतलब पेशाब बहुत तेजी से लगना, and having to go frequently.
Okay.
And sometimes, because of their inability to control their urine, they'll end up wetting themselves.
Yes.
So, when we talk about OAB,
Yes.
it's a complex of frequency, urgency of
Okay.
urine with or without leakage.
Okay. So, ma'am, like how common is OAB nowadays? Like,
So overactive bladder was always there, but I think we were not diagnosing it correctly. So nowadays we as doctors have become more aware,
okay.
but the patient awareness is still not there.
Yes.
So doctors are nowadays picking up overactivity
Mhm.
more easily. So to give you a figure, in younger population, let's say middle-aged women, almost about 30% of them may be having symptoms of overactive bladder.
Okay.
As we reach the age of menopause, almost almost 40% women may have complaints of overactive bladder.
Okay.
And with advancing age, and especially towards extremes of age, such as 75 years and above,
Yes.
both men and women can have symptoms of overactive bladder.
Okay. Especially in the middle age.
Yeah.
People are facing. Okay, like what is the reason behind this issue? Like what is the main cause that people are suffering this problem?
So, one of the common cause, of course, is symptoms of overactive bladder can be precipitated by a single episode of urinary infection.
Okay.
So, you may have developed an infection, and during infection, of course, all of us know that people will pass urine more frequently, etc. But even after the infection has settled, sometimes it leads to symptoms of overactive bladder. Apart from that, in middle age group women, there is no cause known. So we call it idiopathic. Idiopathic as a word medically means something for which we do not know the cause. So that is idiopathic. So that would be the commonest reason for overactive bladder. Apart from that, people who are diabetics, women who are reaching menopause, so changes in hormone levels in the body, people who have a neurological disease, for example, somebody who's had a stroke, somebody who's had Parkinson's disease, or extreme age group, that means simply due to age. So these are the relatively less common causes of overactive bladder, the commonest being idiopathic. That means we don't know the cause.
Yes. Okay, so how patients will get to know that they are suffering from this issue? Like, what are the symptoms?
So common
Can
symptom
see.
would be having to rush to pass urine.
Okay.
That means I need to go. That means I need to go now. मुझे भाग के जाना है.
Means they don't have a control capacity.
They just struggle to reach the washroom
Yes,
sometimes.
yes.
कभी कभी इतनी जल्दी हो जाती है कि जहां बैठे हैं वहीं के वहीं urine can start leaking. So that subgroup where there is a fear of and there is actual leakage of urine, we call them OAB wet. That means apart from the urgency, they actually land up wetting themselves.
Okay.
The second group will describe severe urgency, but they will not leak. So they are called OAB dry. So
Okay.
these are the two main types of OAB.
Yes.
Along with frequency, they also land up going, along with urgency, I'm sorry, they also land up going frequently because the bladder goes on telling them, जाके आओ, नहीं तो गड़बड़ हो जाएगा.
Yes.
So they land up running every now and then to the washroom. Sometimes, especially middle aged and elderly men and women may have nighttime urinary frequency and we call it nocturia. Nocturia मतलब रात में उठ के बार बार यूरिन के लिए जाना. जैसे कि normally we don't have to get up in the night. Hardly ever.
One time.
But patients suffering from overactive bladder may have to go even in the
Multiple
night
times.
more than once, twice, sometimes three times, and some of them they may end up wetting their clothes or wetting their bed during their sleep. So all of these could be symptoms of overactive bladder.
Okay. So how this problem affect like patient's quality of life in their personal life? How does it impact?
So miserably,
Yes.
because those patients are constantly thinking about passing urine. They're constantly trying to think where the next washroom will be available.
Yes.
So when somebody with OAB is out, they know the entire map of where the washrooms are located so that they will plan their activity. Or if they want to go for a long drive, they're very worried. They may actually stop drinking water about an hour or so before leaving their house so that they don't land up getting into an embarrassing situation जब भी बाहर जाते हैं तभी. So it has profound impact on their social life, impact on their personal life. Imagine an elderly lady who's wetting
Yes.
the house, with her urine. Obviously, she's going to be embarrassed.
Yeah.
The third thing is sexual life in women who are sexually active.
Okay.
And they're actually overactive contraction can be precipitated by sexual activity.
Yes.
So it's obviously embarrassing for them.
Yes.
So it profoundly impacts their personal, social, sexual, psychological, every aspect of their life can be impacted by overactive bladder.
Yes. Ma'am, can you suggest us like treatments and measures we can take to avoid this problem?
So, as I mentioned originally, with very few exceptions where overactive bladder can be secondary to some birth defect, we are not covering that in this particular podcast. But the common idiopathic overactive bladder, the treatment is actually holistic. So, what is it that we are looking at? We ask the woman what leads to the overactivity. What is a trigger? Like some women will say, I'm out, I'm fine. As soon as I come home and I put the key in my door, I want to pass urine then and there. Actually, that key has nothing to do with her bladder. But in her mind, she knows that now my washroom is nearby. So now, even if I wet, I'm okay because, I'm not going to be embarrassed.
Yes. Yes.
So we ask them to avoid the trigger. So, what can be the triggers? So, one is, of course, excess drinking, excess liquid. So, some women may be drinking excess of tea, coffee, or in general, Indian people believe that drinking a lot of liquid, that means water, is good for health.
Huh.
No doctor will tell you how much water is good for health. As a result,
Amount.
people drink so much water that they spend half their life in the washroom.
Yes.
So, the first thing that we tell patients with overactive bladder is restrict your liquid to what is required. How do I know what is required? Let my thirst tell that to me. So if I'm not thirsty, I don't have to drink water. I'm not a plant जिसको पौधा नहीं है कि पानी डालते रहना है.
Yes.
My body will tell me when I'm thirsty. So listen to your body. Second thing is find out what are the triggers. जैसे कि मैंने अभी बोला कि भाई दरवाजे में की डालते समय या लिफ्ट में एंटर होते समय तो फिर first prepare yourself that no, I'm not going to pass urine right now and I'm going to hold my urine till I reach where I need to. So it requires a lot of mind body control. The third thing is we tell them to improve their pelvic floor contraction.
Okay.
So, as you know, everybody has heard of Kegel exercises. Kegel exercises basically strengthen the pelvic floor so that by contracting the pelvic floor, we are able to actually abort the overactive bladder signal. So the signal will reach the brain, but the bladder will not respond because we've contracted the pelvic floor. So we actually train both men and women, women more common because the disease is commoner in women. We train them to contract their pelvic floor correctly. And then when they get that acute desire to pass urine, instead of rushing to the washroom, the first thing is they have to sit down, tighten the pelvic floor, relax the pelvic floor, then get up and go to the washroom. That way, the contraction cycle is aborted and they have that much time to reach the washroom on time. So, that intense desire will settle and maybe the leak may stop completely. So, we train them how to avoid the leakage and how to contract the pelvic floor. So, that is another thing. Women who are approaching perimenopausal age group, we encourage them to have a good gynecological checkup done. Some of them may be candidates for hormone replacement therapy. Of course, we tell the patient to get the urine examined to make sure there is no infection, etc. Many patients will respond to all of these measures. Those who don't, of course, we need to put them on some medication. Pelvic floor exercises are not going to work overnight. They are going to take a while. So, till such a moment that they're sure that they are able to hold their urine, we put them on some medication. So, that is the way we proceed with the treatment. Yes.
And can you tell us, ma'am, like what food items we can avoid or what food items we can have?
So, not so much the food, but certain liquid items, for example, tea, coffee. So, not only it adds to the liquid volume, but both caffeine, tannin, all of these are bladder stimulants. Okay. Then women who are overweight, we will tell them to watch their diet in such a way that, first of all, we encourage them to lose their weight. Overactivity and being overweight are very closely related. So we ask them to watch their weight. We tell them how to adjust their liquid drinking habits so that सोने के पहले चाय कॉफी नहीं लेना है, बाहर जाने के पहले चाय कॉफी नहीं लेना है. Third thing is excess of aerated drinks. We ask them to avoid doing that. There are people who are fond of drinking a large volume of beer. That's going to precipitate. So it's not so much the food items, but it's the liquid, both the quantity and the quality of liquid that you drink, which will impact the symptom of overactive bladder. So they have to watch that.
Fruit juices and all are fine.
Everything is fine, but how much? Tomorrow you will say that, okay, fruit juice is fine, make liter pee leti ho. No, because they all contain sugar. So first of all, they're going to make you put on weight. And secondly, the liquid, because every juice has liquid. So you really don't need to drink so much of liquid. So the volume, which is the quantity, and then the type of liquid. Both of these have to be looked after. Food wise, some people say spicy food precipitates their symptoms. There isn't a lot of scientific evidence for that. So, food wise, I wouldn't particularly fuss when it comes to overactive bladder.
Okay. Now, doctor, can you tell us about what is behavioral therapy?
So, behavior therapy is exactly what I just mentioned. You know, looking after your lifestyle, looking after your liquid intake, being overall active, encouraging the patient to lose weight, avoiding any drinking 2 to 3 hours before bedtime because our kidneys also need to sleep. There are some women or men who will drink water every time they get up to pass urine. So every time kidney is going to be fed liquid. जैसे कि आपको और मुझे रात में सोना जरूरी है, kidneys also need to sleep at night. So we tell them to have early dinner, have a gap of about 3 hours between bedtime and dinner time, and have no liquid when they get up to pass urine. Because otherwise that cycle goes on repeating. They'll keep on drinking water, they'll keep on passing urine. Those who are smoking, we discourage them. Not that smoking has a direct link, but as a good health measure, it's a good idea. Reduce or stop alcohol if they can, because alcohol itself can be a diuretic. So all of these are little lifestyle changes which will help.
Okay. Now, last question to you, doctor. Like, what is like bladder diary?
So bladder diary is basically keeping a record of the amount of liquid that one consumes and the time when one consumes that liquid, and also writing down the time when one passes urine and measuring the urine each time. कितने बजे हुआ कितना हुआ. In addition to measuring the time and the volume of urine, patient is also asked to note down if she leaked urine. So she just writes leak. So one look at that record and I'll come to know how often is this person drinking water because I have asked them to record the liquid intake. I'll come to know how frequently is this person passing urine because frequency is a component of overactive bladder. I will come to know what is the volume that they have passed each time. So that will tell me that is the bladder really irritable so that हर टाइम 50 ml में कर रही हूँ 100 ml में कर रही हूँ. That means I'm really rushing every now and then. Yes. And last but not the least, I will find out how often this person has leaked. Yes. So this is person's self-maintained record, which I will use to decide how severely the overactive bladder is impacting their quality of life. This bladder diary, we ask our patients to maintain it before we start any treatment. And once they are on treatment, say about 2 months down the road, I will ask them to maintain the bladder diary again. Usually, a diary for 3 days is good enough. And as a part of follow, we ask them to record the bladder diary just for 1 day. And one look, and I know that things are better. The frequency becomes lesser if they're following the treatment correctly. The volumes passed each time will become better. The leakage episodes will be less or may have stopped completely, and night frequency will also become less. So, bladder diary becomes a tool for self assessment for the patient and for me to assess if they're responding to my treatment. So, bladder diary is a very, very important tool in both diagnosis and management of overactive bladder.
Okay. So, doctor, lastly, I want to ask you that what medicines you want to recommend the patients who is suffering from this problem, OAP?
So, Deepa, as I mentioned, those who I want to put on various lifestyle intervention and what we call as conservative management of OAB, because these take time to work, we like to put our patients on certain medications. Yes. These medications relax the muscle of urinary bladder so that वो बहुत जो चुलबुलापन है bladder में that comes under control. Medications are available very easily in Indian market. Yes. A commonly used medication is a drug called solifenacin, which helps in relaxing the bladder. Another drug is stolterodine. One more very popular drug is a drug called mirabegron. All of these have different types of different mechanism of action. They all have some slight side effect, but provided the patient is aware of it, usually side effect is not that much of an issue. A new drug which is now available in Indian market is by the name fesoterodine. The advantage of this drug is that it has one of the best side effect profile and yet the effect on the bladder is excellent. So all of these four drugs are the ones that we commonly use in patients of overactive bladder. The drugs are not meant for permanent use. The drugs are meant to help the patient overcoming the symptoms of the condition. Usually, we call the patient after about, say, 2 months to 3 months for a follow up. Yes. By then, most patients will have learned how to control their bladder trigger. They've learned what liquid intake is enough. They've started their weight loss program. They have managed to have a gap between bedtime and dinner time. That is the time that I will start tapering the medication. Okay. So that the aim is to have the patient control the symptom of overactive bladder without any medication.
So, doctor, this was really very informative for all of us. And so, ma'am, can you tell us a brief conclusion about to the patients, like just a small thing that how they can, what changes they can make in their personal life?
So, the first thing, Deepa, I would encourage people to talk about it. We are in India, and Indian women, and especially their urine, is not a priority.
People feel shy.
Women feel shy, and in the family, that is not a priority. Other people's other diseases is a priority.
Yeah.
So I think it's about time we tell our mothers, grandmothers that talk about your urinary symptom.
Yes.
Because don't think that this is something that you have to live with. So please, please talk about your symptom. Talk to your family members because only then they will help you by taking you to the doctor.
Yes.
Overactive bladder is not a dangerous condition, it's a quality of life issue. And talking to the doctor will help you, not only in dealing with the symptoms of overactive bladder, but it can actually be cured. And there are newer and newer medications available. And this is one condition where very rarely a surgical intervention is required. So the first message is talk about it.
Yeah.
Second is follow all the treatment protocols religiously.
Yes.
And thirdly, if despite that your symptoms continue, nowadays we have various endoscopic treatments available, such as injection of botulinum toxin,
Okay.
which film stars put on their face.
Yes.
We put that injection in the urinary bladder, and it is something which we keep in reserve for patients who may be having refractory form of overactive bladder. That means something which is not responded to all the earlier measures. So the bottom line is talk about it. There is treatment available.
Okay. That's really nice. So that's all for the day, ma'am. Thank you so much for sharing such
Thank you so
information.
much, Deepa. I wish to thank MSN Laboratory for asking me to speak on something which is so important. I hope everybody finds it useful. Thank you so
Thank you
much.
so much, ma'am, and have a great day.
Great day. Thank you so
Thank
much,
you.
Deepa.